Colin Powell opening up to journalist Bob Woodward about his struggles with cancer and Parkinson's disease and what may have been his last interview.
I have to get all kinds of exams, and I'm a former chairman, so they don't want to lose me. So they make me come there all the time. I've taken lots of exams, and I get there on my own. I drive up in my Corvette, get out of the Corvette, and go to the hospital. I have multiple myeloma, and I have had it for almost 2 years now. I think August makes 2 years. I have taken all the medication and exams they want me to, and I have never given up a day of work.
So joining me now is the former acting director of the CDC, Dr. Richard Besser. Doctor, thank you so much. I appreciate you joining us, especially on this subject. General Powell was fully vaccinated, but also battling both multiple myeloma, a blood cancer, Parkinson's disease. So please set the record straight for us. He was very fragile, in very fragile health, and his death has nothing to do with vaccine efficacy, correct?
Yeah, you know, what a loss for our country, and what a life he led, and it would be a shame, Don, if people took the wrong message away from this in terms of vaccines. The general was fully vaccinated, but one thing it's very important for people to know is that even for people who are fully vaccinated, the vaccine is not 100%, and for someone like General Powell, who had a type of blood cancer that affects the immune system, the likelihood that he had a good immune response was low. So it really supports the value in vaccination even further, because we vaccinate to protect ourselves and those around us, and we vaccinate to protect those people who may have medical conditions where the vaccines won't work very well. And you can't tell who those people are just walking down the street. But being part of a community, being part of society, is that we do things to protect not just ourselves, but to protect those around us.
Yeah, as I understand here, Doctor, Colin Powell was scheduled to get his booster shot. How much protection do you think do booster shots offer people who are living with symptoms?
Well, you know, clearly now the feeling is that 3 doses is the way to go for people who have conditions that lower their immune system. There's no guarantee, even with a booster shot, that your level of protection will be as high. If your immune system is not responding to the first 2 shots, maybe you'll get a better boost. There are studies to show that it will, but there's no guarantee. And that's why it's so important that people around him were vaccinated as well.
Yeah. The New York Times is reporting tonight that the FDA is planning to allow Americans to receive a different COVID vaccine booster than the one they initially received. According to the Times, the FDA might suggest that using the same vaccine as a booster is preferable, but won't recommend one shot over another. Talk to me about that. How significant? Is it significant?
Well, you know, I want to wait and see what they say, because the science is limited. But a study last week from the National Institutes of Health demonstrated that people who got one of the mRNA boosters, so Moderna or Pfizer, regardless of what they got for their first one, got the best boost. So people who got J&J, getting a Moderna booster, a Pfizer booster, gave them a better rise than J&J. You know, just for the record, our foundation was founded with money from the Johnson family fortune, and we have stock in the company. But the data are saying that the mRNA boosters do a better job. I'll be interested to see what FDA says, because there is limited data, and it's very confusing right now for people who want to get boosters, having them available for some, but not for everybody.
The former FDA Commissioner Scott Gottlieb is calling for urgent research into a mutation of the Delta variant known as Delta Plus, following a surge of cases in the UK. I mean, when I first read this, I said, oh my gosh, here we go again. COVID numbers in the US have been improving recently, so how worried are you that this could throw us off course again?
Well, we need to remain vigilant. Whether this variant will turn out to be a problem or not, until this is controlled everywhere in the world, we all remain at risk. And the vaccine numbers in the U.S. have been improving, but they're not as high as they should be, and they're not uniformly high. Some communities have vaccine coverage rates that are above 80%, and some are down closer to 50%. We need to get everybody the information they need so they can make decisions and get vaccinated. Yeah, and we need to do more to provide vaccines globally, or we all remain at significant risk.
Listen, you're the former acting director of the CDC, and I was glancing down at a piece that you wrote in The Hill about the impact of the child tax credit on health equity. And here's what you write in part. This is a quote. It says, the budget reconciliation measure is the best chance in decades to help create an America in which skin color, income level, neighborhood, disability, occupation, and immigration status no longer determine how long and how well people live. Can you talk to us about what those federal dollars have meant to struggling families?
Yeah, if you think back to the beginning of the pandemic and the economy was just